My podcast is every Monday night at 8 o'clock, similar to you guys, and we talk about current events. We talk about medical things. Like tomorrow, we're talking about vaccines because we have our community, African American community, does not believe in the flu shot and other vaccines. And also, we're talking about the coronavirus. You know, that's coming. That's China, Wuhan, hot topic.
Oh, God, I thought you were talking about beer.
We're going to talk to Fang.
It ain't
And
a
I
corona.
really appreciate you, Fang, for coming on. Now, Fang, you're Chinese?
Yes, I'm originally from China.
Okay. But you're here in the US, correct?
That's correct.
Okay. So what's your background? I know you went to the University of Michigan. Can you tell us a little bit about yourself?
Yes, so I grew up in China, and in 2009 that I came here for a PhD study in a field of chemical engineering, and I graduated in a year of 2015, and I from there I was working for one of the biggest chemical companies, the Dow Chemical Company in Midland, Michigan, till last year. And since last year I've been working in the IT field in Dearborn. So I'm trained in a general field of science and engineering, but not directly in a health care related field.
Okay. And how long, like, you grew up in China and then you migrated here when? Like, how old were you?
I was in my early 20s. It was 2009.
Okay. Okay. And so I just wanted you, because you kind of commented why you're one of my friends on Facebook. And I think me and you kind of connected on the whole single parent thing. We just kind of been Facebook friends. Like, we have never met in person. However, yeah, I posted the video of the most exotic market in China, which right now it's a big thing. And I think there's a lot of misconceptions going around where people think that everybody eats these exotic animals, where there were like a lot of different animals on there. There was dogs, there were cats, there were snakes, there were all bats, there were all kinds of stuff. And I thought was very important to hear it from you, somebody who's from that country, to really clarify, that everybody doesn't eat like this.
Yeah, you're correct. That the statement that everybody in China eats like that, or agree to business like this, is way far away from the truth. Well, China is very diverse and very, very, very big. I can only speak for myself and the people around me. We don't eat like that. In fact, a lot of my family members are vegan. A lot of them, some other, members of my family or my community eat meat, but we don't eat wild animals, or we don't agree to this lifestyle. Yeah,
Is that
because
of a religion or anything? I'm sorry to cut you off. That's not a religious thing. It's just the way that you always grew up.
I heard that some part of China eat some things like that. They got animals in a forest and then eat the animals, but I don't think that's a China specific issue. In fact, during the early discussions of this outbreak, people posted a video or pictures of people eating bats. Those become very famous, but they later turned out to be in other countries, not in China. So but the video you posted on the internet, I think it's from China. I'm not 100% sure. I'm just saying that's not representative of normal Chinese lifestyles at all. But I do not deny that there are corners in China where there are people like that. But if you think about the world, people hunt in the United States. They call wildlife, so it's not a Chinese specific problem. This outbreak of virus is very unfortunate, but I think it's important that we as humans work together instead of like discriminating each other.
Yes.
Yes. And I think everybody can be the victim of discrimination or especially racism, no matter what color you are. So
Yeah.
yeah, it's
Sexism, racism,
yeah,
xenophobe, all of that. And that's not acceptable because you saw a video on the internet.
that's
So
correct.
I thank you so very much. You're very highly educated, and I want to really, thank you for coming on because you really stepped out of your comfort zone to just, none of us can really represent a whole entire race, but
Yes,
we have never been, me and myself and Hawa, we are first generation American in our family as well. And we can't speak for everybody. However, we have experience here in the United States as well as in another country. And when you hear it firsthand from somebody, I think that can help
It can help
erase a
to
lot of the
erase the
stigmatism.
stigma.
So
mm-hmm.
thank you
Yeah, I
so much.
appreciate the opportunity. Mm-hmm. Yeah.
Thank you. Take care.
Yeah, you too.
Thank you.
Mm-hmm. Bye-bye.
Bye.
Bye. Okay, Hawa. So I'm gonna let you go ahead and introduce yourself while we wait for the other two to come on the show. We already did our podcast, me and you, Hawa, together, and you were very well versed in vaccines, but me and you are kind of like a tag team on Facebook trying to make sure that people don't have bad information, because everybody becomes Dr. Google for some reason on Facebook because they heard, and then there's lots of rumors that start, false rumors that they're spreading. So let's hit on some points in your area of expertise. I want to hear a little bit about your background, and we'll go from there.
Well, thank you for having me again. My name is either pronounced Hawa, as my childhood friends do, or Hawa, so I can go by either one. I am Dr. Hawa Hoff. I am a family nurse practitioner, and I've been a nurse practitioner since 2002. I've been an RN since 1997. I have a doctorate degree in nursing. That's why I'm Dr. Hawa Hoff. And I have been in healthcare for a long time. I used to work at Henry Ford Health System for about 21 years in a lot of roles, in nursing as a nurse practitioner, in MICU, assistant nurse manager. I used to run a free clinic in Detroit, assistant clinical director. I used to work with vaccines as a public health nurse. I ran a school-based clinic. I dealt with vaccines. And so currently now I work for a pharmaceutical company, and I deal with viruses and vaccines and immunology. I am not a salesperson. I always have to tell people this, but my background is in the science behind vaccines and I can't say, behind vaccines, immunology, and biology. That's a hard word for me to say right now, obviously.
That's
so,
okay.
What we talk about is
virology.
Virology. That is it. Thanks.
Yeah.
I couldn't get, my tongue was tied, but
it's okay. It's a lot, girl. That resume is woo. Go ahead.
But what I talk about is vaccines, immunology, the way the body responds. We talk about disease states related to this. And what I've been talking a lot about is coronavirus, or COVID-19, or SARS-CoV-19. So like lovely host stated, we are trying to get people on the right track because there's so much wrong and misinformation, and we are in a state of a pandemic. We haven't had one in our country in years. I've never lived through one. A lot of people that are in our leadership roles have never ever lived through one. So it's kind of like finding your place as this thing kind of unfolds. So I'll stop there if you want to ask any questions or have me touch on any topics.
Okay, so what are some of the things that you have been trying to educate that you're seeing on Facebook? Because I know there's a variety of things, from gargling salt water to your melanin is going to be protective of you not getting the coronavirus.
Oh
to
my God, yes.
What myths are you seeing? Let's talk about the myths first.
Okay, let's first just say coronavirus is a virus. Viruses, there's not a current medicinal treatment like a pill you can take, even though I know we're gonna hear some stuff from you in regards to what you found out, but viruses do not typically have a cure. They have to run their course. And some people and some things I've seen on Facebook, and I'll say my goal is to get the right information out. So some of the myths that this virus knows when someone has black skin because it can tell our melanin, and then we are not susceptible to the virus, which means we can't get it, we can't catch it. It's resistant to us. We are a powerful people of deep, rich skin. No. As we just heard, Idris Elba just contracted, he tested positive, and he has some beautiful melanin.
Wait a minute. I don't have my bell, so I can't. Ding, 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 ding. Okay, go on.
I got something for you.
Okay, who's that?
That's Dr. Deloria Griffin. He should mute his phone. He's up next after you're done.
How do I mute my phone?
Wait, huh?
How do I mute my phone?
Oh, in the corner, it says mute at the bottom if you're on your phone. I'm sorry. I should have probably.
He did it.
He did it. Okay, I should have went through some housekeeping before we. Go ahead, Howard. So number one myth is your melanin does not protect you from the coronavirus. Got it.
You got it? Because they don't have it. They still think.
Oh, say it again.
Oh, let me say it for the people in the back. Let me say it for the
Okay.
people in the back. Or the lady that was at the store today that told me, black people can't get it. And I'm like,
Huh?
Yeah, she told me that with her gloves on in the store.
Ooh.
And
Okay.
somebody
was typing at the grocery store. They was typing in my order with gloves on. I'm like, why you got gloves on? She's like, because I can't wash my hands and use sanitizer between every person. I'm like, why? But wait, huh? Why not? I do between every patient. I use sanitizer or I wash my hands between every person. And she's like, well, that's just gonna take too long. Okay. All right, let me just get these groceries to get up out of here.
Yeah, and let me go sanitize my hands when I'm through with you. Yeah, so that's one myth. It does not detect skin color, people. So please know that. I don't care if you black, purple, blue, orange, brown, white, yellow. It doesn't know your skin color. The other thing is that you cannot gargle this virus away. So there was some floating around on Facebook that says, oh, it lives in your throat for 4 days. Like it doesn't go anywhere. It just stays in your throat, right? How does that happen? And all you have to do is gargle with salt water, or even there was we think apple cider vinegar is for everything. So it's for a corona.
Wait a minute. No, I know for a fact, if you from the east side and you have burners, you will not get coronavirus. That's what I heard. I saw it on Facebook. They said Detroit ain't afraid of no corona because we got Verner's pop. Go ahead.
You go. Verner's will cure a lot of things. Now I'm from Detroit and I'm West Side. I'm not saying that it won't.
Wait a minute. So you trying to tell me ginger ale is gonna cure the corona?
No,
what you're saying?
No, I'm not saying that. I said it works on a lot of things, but it won't work on corona. Okay, ginger is very good for stomach upset. So that's what we get with the ginger in the ginger ale, and we just got this wonderful Verner's that is the bomb. But no, not for corona.
Okay, so that's a myth too. And I don't have a bell. Okay, ding, ding, ding. So myth number one is you cannot gargle. Well, was it gargling it away? Or that's number
gargle.
You cannot.
The first one was the melanin. The first one was melanin.
Melanin will not protect you. So the darker skin you are, you will not be protected against getting the coronavirus. Number two, you cannot salt water gargle it away. Correct? When you have a sore throat. Because is the sore throat even one of the symptoms of corona?
It's not one of the symptoms. High fever, shortness of breath, and cough are the three main symptoms of corona.
Correct. Okay. So I think there's some misconstraints because there's a lot of people in the ER, urgent care, and on my telemedicine that think they have corona, but they might have just a cough. So should I come see you if I just have a cough?
Oh no, please don't. Please do not come and bombard the health system right now, because there are some people who have more than a cough. And when you come in with your cough and you don't have the high fever, the shortness of breath, and the cough, it's like you need to have at least one or two of these symptoms. You just need to call your doctor, call your primary doctor. There's hotlines out there and let them talk you through it, because if you actually had coronavirus, symptoms are typically mild. And if you had coronavirus, it would usually affect you like you had a cold. Colds, there's no medicine to cure virus. You just need to take care of yourself, treat the symptoms. And what we want to do with corona is self-quarantine. That means stay away from people.
Oh, okay.
Do less out in these streets. Don't affect your co-workers, the cashiers, the people out in the street, the gas station attendants. Stay home, people.
Okay. So is there any other myths that you saw on Facebook?
Oh, Facebook had one, and I have to say, this one really made me tickle, because they said if you swallow the virus, so remember we were gargling the virus away, but now if you swallow the virus, drink some warm water and swallow it, and it gets into your stomach, then the stomach acid kills the virus.
You know what? I didn't hear that one. That's interesting. What I heard was you need to go into a hot sauna, because the heat will have like how when you have a fever, it's going to heat it up, and all viruses die in heat. I heard that.
Okay. Oh, that's a new one for me.
Okay, so myth number 3 and number 4, we're not going to be drinking any warm water because it's not really going to do anything but go in your stomach. And then going into a sauna, heating your body is not going to kill a virus. Am I correct?
Correct. And I just want to say one thing about that stomach and the stomach acid. If that was true, people, why do we have stomach viruses? Because you still have acid in your stomach. It's not killing that virus.
Oh, oops. I don't have a bill today. Okay, but you're making too many points right now for me to. Okay, all right, moving on. Is there any other myths that you've heard?
Not that I've heard in regards to why you can't get it and how to get rid of it. Nothing else that I've heard.
Oh, I heard one. How about if you are a young person, like in your 20s, you can't die from it because it's only affecting older people. That's it.
Oh, wow.
This is an old person's disease, not a young person. Yeah.
Wow, that's a new one. Okay.
That's not true either?
No. It affects everybody. Children, 14, adults, 21. There was a news posting right before I got on that said a 21-year-old had unfortunately succumbed and was deceased related to coronavirus. So
I did see a soccer player. I believe he's from Spain. I did post it on my Facebook. I don't have it in front of me, but a soccer player, age 23, yes, has died from corona. I want to say either Brazil or I can't remember what country it was from, but I'll look that up. But I posted that on my Facebook page today, and yes, they just said that he passed.
So it doesn't know how old you are when it infects you. It doesn't know what color you are when it infects you. And it doesn't matter if it's in your throat or your stomach, you have it. It's not going away. That's as simple as I can put it, people.
Okay. All right. So I'm going to have you hold, please, and have you come back in just a second. Let's get Dr. DeLorean Griffin on next. And I want to talk to him. He is in plastic surgery, and I'll let him give you a rundown of what he does. Dr. Griffin, can you unmute yourself?
Mute. What's happening?
All right. Hey, how are you?
I'm good.
So, we just want to hear a little bit from your perspective. Give us a little bit of rundown about who you are, what do you do, and anything you want to tell us just in general about coronavirus from your perspective of where you work in the hospital.
So Dr. DeLorean Griffin, board certified plastic surgeon, plastic and reconstructive surgeon. What do I know about coronavirus? Well, what's my background?
Yeah, you go ahead and do your background first, and then we'll go into the coronavirus.
Starting where?
We don't got that kind of time, okay?
We don't got that kind of time. So I did med school, Wayne State School of Medicine, stayed at the DMC, did 5 years of general surgery, trauma, and critical care, where I took care of the sickest patients. That has started to affect my family life. So I said I need a change of career. So I did a fellowship in plastic surgery and had more time for my family, a better, more of a lifestyle conducive to maintaining a family, I should say. And I've been in practice almost 5 years now at St. Mary Mercy Hospital, Livonia.
Okay. So I heard that according to, I don't know who that was up there with your President Trump, that was saying that they had made recommendations.
He's an idiot. I was so proud to see a black man surgery in general, but he's let me down. I could have known.
So do you not agree with halting all elective surgeries at this time?
No, I agree with it. I was in the position where there was a lot of ambiguity around whether that should be done or not. And, it kind of went from, well, we should, kind of use a discretion when boarding these cases to kind of, we would, leave it at the discretion of the surgeon and the patient to, we're implementing it, we're mandating it as of today, which I'm okay with. I'm okay with. I was worried that a lot of the patients weren't going to get, even though I do elective surgery, there's a lot of medically necessary stuff that I do as well. So we're still able to do those type of cases, any type of trauma cases, any type of wound care, any type of acute issues that occur in plastic surgery. But the elective stuff we got to put on hold. And there's no real standard across the board about what should be done. Only that our hospital implemented a policy of a 3-week period of time. So we pushed those patients back, and I'm okay. It's going to be a little. I'll be a little antsy because I like to operate, but I'm okay with it. It's for the sake of public health.
So, for instance, if I had I don't know if this is plastic surgery, so to say, but if I was coming in to get, let me do some plastic surgery. I'm coming in to get my 360 lipo tummy tuck with the booty and whatever. I'm getting my mommy makeover scheduled for the 23rd. So you're telling me I have to wait 3 weeks now? Or
yeah, all of my patients, and I had quite a few of them, because March is probably the busiest for me. It's always been the busiest month for plastic surgery. Everybody's, I guess, getting their tax money and willing to blow it on me and my services, and also they want to be ready for the summertime. So March is always, I call it March Madness. So we got to do what we got to do. So we rescheduled those patients already. I was scheduled to go to Nigeria at the end of April, but being that there was one case of coronavirus, we decided, I was working with, decided to cancel that. So we were able to put a lot of those patients in that slot.
So you were going to Nigeria when?
Oh, I was going at the end of April. It was April 27th for a week, essentially.
Okay, so very good. So have you already started your preparing to take your anti-malarial medicine?
No, I'm not going now. I'm not going now. It got canceled.
Okay, but you're not gonna
Yeah,
go at all. So you're not. You're
it got shoved, and I figured it would
okay.
happen. So, but yeah, had I gone, yeah, we would have taken anti-malarials just like I did when I went to Ghana.
And how long did you take the anti-malarials for? Did you take it 2 weeks before traveling and then 2 weeks
It was
after?
no, I think it was I think it was 3 days before, and then the week of the trip itself. It was something like that.
Okay,
It wasn't a full.
you're just there a week.
Yeah, I was just there a week. Yeah. Uh-huh.
Okay.
Interestingly enough, they're saying that may be a reason why the rates are lower in Africa, though I think that's unsubstantiated.
I'm glad you brought that up. I'm going to get to that at the end in about 5 minutes. I'm going to go into treatment options, and it does include anti-malarial medication. But right now, what we like to do is, what they treated Ebola with is what they're trying right now to treat this virus as well. And the medication they use to treat Ebola is also HIV antiviral. It's more expensive. And of course, they're giving it to those that are vented patients that are very, very severely sick and inpatient. There's not enough studies right now to substantiate any of them. They're just kind of trying things. However, there have been very good results with the anti-malarial and zinc. And I have a whole YouTube channel that talks about the protocol. However, it's like people are scared to do something that doesn't have a whole lot of trials behind it. But we're in crunch time, and we don't have time because lives.
Right. No, I think that we're probably a good. I heard that was about 18 months away from a vaccine for coronavirus, this particular strain at least.
Yeah.
But
yeah, it's interesting. I think there's a combination of things going on in Africa, and I think that does need to be more researched, such as G6PD deficiency. These patients do not have to take anti-malarials at all when traveling because mosquitoes don't bite them because it's genetics.
Yeah, I know that sickle cell patients in particular are resistant to malaria because they can't bind them.
Exactly. So these are the ones that really need to be studied. The G6PD deficiency, the sickle cell patients, and those who have tested positive or been treated for malaria in the past, even if it was prophylactic. Because my theory is we can, as healthcare providers, we're the highest at risk, especially if you're in anesthesia, ICU, respiratory therapists, and surgery, of course. You guys are dropping tubes and you're very much in the face, and we don't have a lot of, you're in the face of the patient that may be positive, and we don't have a lot of PPE equipment. You can see from pictures Korea and China, and they are in head to toe hazmat gear.
Oh yeah.
And we don't even have masks on.
We don't. And so that was an interesting thing too, because I read an article on why the Chinese and Asians in general are just more vigilant when it comes to, protective eyewear, protective, masks and everything else, and why we don't.
I think that has a lot to do with our government not being prepared. I really think that we lack preparation. Let me bring Howard back in because we're down to our last.
I was going to say something just about that. When I was at meetings at the CDC, and one of the head infectious disease doctors, Dr. Messner, said that we weren't prepared as a nation for a pandemic. Again, when I stated at the beginning, we haven't lived through a pandemic. We don't know what to do when we're closing schools and bars and restaurants and how to supplement income. So we're not prepared. And
Yes.
one
that shows.
other profession that we forget to think about, and I have a couple friends that are dentists. They are really, they're like, please close us down because
Wow.
yeah, so
Yeah, they are they're also right there in the patient's face.
yes.
And they can't screen you coming in the door. They're just there to pull your teeth and
Right.
clean your teeth. And yeah, so I feel for a lot of things. I'm kind of in my feelings because the daycares are now next on the list to close. And so when you're losing people, like I have coworkers that have been quarantined as of yesterday. So we are short 2 providers already in an already short staff situation. And then now, and we're limited on testing. So not everybody's going to get a test unless they have all of the symptoms. So one may have a fever and not a cough. Another one has a cough and not a fever yet. And I mean, this is kind of like the home triage. We got to go with the sickest of the sick that are going to be, we're not, and some people are like, hey, I feel like you're sending me home to die. And I feel for them, but I want to really iterate that people can utilize telemedicine. You can call in and have a face-to-face visit. There's many platforms. I myself am on Amwell. Well, it's called American Well. You can download it on your phone and see somebody today, 24 hours a day, nationwide. Doctor on Demand. There's so many. Those are the ones that I know that are popular off the top of my head. But don't hesitate to contact us. If you guys want to give your information so they can contact you, your social media or anything, we have about 4 more minutes. For me, you can find me on Facebook, VSHIVACHI, or I am Nurse Practitioner V on Instagram, or the Real Nurses Detroit on Facebook. Go ahead, Hawa.
I am Hawa, Hawa, Hoff, Hoff on Facebook, and on Instagram, I'm Dr._Hoff.
You're my sword too, I believe.
I know, yes, bruh. Hey.
Rude. So yeah, Dr. Griffin, DeLorean Griffin on Facebook, Dr. Griffin Plastic Arts on Instagram. I'm still taking consults, actually. We're doing a thorough screening process. I could barely get into my own hospital today, so we are still seeing elective consults for elective surgery, but we are doing a very, very thorough screening process in this time.
Is that face to face or is that by video? Because a lot of us are doing telemedicine right now, so you're doing face to face.
No. Yeah, this is actually face to face. We're kind of antiquated with our hospital system, so we're kind of taking that. It's still kind of taking that risk with bringing in patients with a thorough screening process. So, got it. They kind of want to keep the training going somehow.
I have a question. Do you see yourself or that practice taking a bit of a hit in regards to this, in regards to,
Well, in the short term, there's going to be a hit, obviously. But in the long term, I see myself taking a hit too, because I think there's going to be an economic calamity that's going to have a lag time. And it's not about if, but when.
Yeah.
And so while my elective stuff, nobody's going to, even if they have the money, they're not going to prioritize getting elective plastic surgery. At least I see in my mind, even though the demand might be there. But
especially when you have to choose your bills and keeping a roof over your head versus getting surgery. It's kind of like you're going to be penny pinching a little bit.
Yeah. For me, that's what an advantage. Everybody's always asking me, why don't I go private? Why don't I go private? Because of reasons like this. When the economy goes, you're struggling when you have to pay your own bills. So I get a salary regardless. Two surgeries or 200 surgeries, I get the same salary. That's my bonus.
So very good. I'm just gonna have you guys mute, and I want to play just a little bit of sorry. trying to do two things at once. I'm going to try to play just this for last 30 seconds, and you guys can find me on the Real Nurse of Detroit, our YouTube channel. And this is just my theory on how we can possibly have good outcomes with treating patients as soon as we know. And then we'll close out.
Zinc
Thank you guys for coming.
And chloroquine were added to the cell culture medium. So the question is this being used? And to that, I turn to Korea Biomedical Review. Physicians work out treatment guidelines for coronavirus. Notice that this is published here on the 13th of February when they were starting to see an uptick in their cases in Korea. And the article goes on to say, Korean physicians treating the patients infected with the new coronavirus, COVID-19, have established the treatment guidelines for the unpreceded coronavirus. The key guidelines are the following. If patients are young and healthy, then they will be observed. If more than 10 days of...
So with all this being said and all the information, we want to talk about treatment if you do get it. And the reason why I came to this conclusion is because of my younger brother. If you didn't know, I am first generation American. Both of my parents are born in Kenya. I have traveled back and forth to the continent or to the country, continent of Africa to the country. And every time that we go, we have to prophylactically take chloroquine 2 weeks prior to travel and 2 weeks after. The whole time that we're there, we take it daily as a malaria prophylactic to prevent us from getting malaria. My brother and my other siblings have had malaria in the past, even while on the prophylactic. And he made a suggestion that, hey, I don't really get any colds since I've had malaria, and you really need to look into that. That may be the cure to this coronavirus. And he was right. So with that being said, my brother is not in the medical field. He just was talking about experience. I just want you to know to listen to suggestions. It may be a layman that has a good idea. It's worth looking into. So it took me a couple of weeks, and now before the epidemic or the pandemic even made it to the US. But after looking at it and seeing how it replicates on the RNA level, very similar. It's a protozoa, but it replicates as an RNA through the red blood cells in the liver, which is very similar to the zoonotic infection of corona from animal to people infection. However, it replicates by viral on an RNA level. And if we can stop that replication, we cure it. So I will post additional guidelines that have been posted. We want to keep in our prayers and in our thoughts all the healthcare workers that are working tirelessly and under a lot of stress and frustration in the midst of all of what is going on. We're figuring out as we go along, but we also have those that are carrying the mail. Dentists are high on the list of physical proximity to others. Paramedics, nurses, flight attendants, PCTs, CNAs, police officers, garbage collectors, maids, janitors, healthcare or childcare workers, cashiers, pilots, lawyers. We are all in this, and we are all being exposed. Bottom line, you can feel the frustration on Facebook. You can feel the state of emergency. But from my perspective, because I'm internal medicine and I am inpatient as well as outpatient, I see patients in the homeless population 2 days a week, outpatient. So I have no idea what I'm getting exposed to on a daily basis. So I really want the healthcare workers to really take care of yourself, advocate for yourself. Please, if you feel like you need a mask, get one, use it, because right now we're chasing this issue, and I want everybody to stay safe. So the whole purpose was to make sure that you didn't have any misinformation. But hit us up on any of our Instagram or Facebook if you have any additional questions. Next time, when all of this dies down, maybe in a month or so, I hope to have you back, Hawa, and thank you, Dr. DeLorean.
Basically,
so
the heart just grew and
and we'll
grew,
go
so
from
my
there.
heart was 4 times
Thank
the
you,
size of a
guys.
regular heart.
Good night.
When I was playing
Good night.
basketball at Eastern Michigan University, I would say I was pretty good. Heart issues came about, I got really sick. UCLA saved my life. Oh, this is really nice. It was a trying time for me and my family, and UCLA, the way that they dealt with us, they treated me like, okay, we've seen this, we know how to deal with it, just stay positive. It was great. Oh, that's dope. What? For me to get a jersey, and it actually has my name on it, and my old college jersey, no number, that was nice. I will be wearing it a lot. Here I come, coach. There was a lot of emotions. Being happy to be here, like, wow, this is happening for me, this is happening to me. And then I got people I love with me. So this is an experience I will never forget. My name is CJ Urquhart, and I'm a Laker for a day.
Awesome. I can't stop smiling. I was so happy to see you. Some good news, actually.
Right. that was actually fun, and that was a really good experience. I had a good time. It was cool though. I like them cameras and stuff follow. That was nice, that I got a chance to spend that time with my family and my friends.
Right.
And it was pretty cool, It made me feel like I was worth a few dollars.
You were worth a lot of dollars. So tell us about you're in LA right now, right?
Yes.
What's it like in LA right now with the whole coronavirus and 24-hour lockdown? Didn't y'all start that?
It's not enforced. It's a lockdown, but it's not enforced like we were just talking, it's not enforced on the level of what people think it is, where you just got, police patrolling the streets. I think they're allowing people. That's terrible to have to say they're allowing people.
Yeah.
But people are able to, make their, go do the necessary things, like get all the necessities and things like that. But, as far as like the vibration of the land is not hysteria or like yet, but you have your extremists, I'm pretty sure, like everywhere, where people are just going crazy, buying up all the stuff. And I kind of, during these type of times, people lose their ability to be logical, because fear sets in and creates an emotion. So people lose all logistics. They don't even know how to think straight, so, you got some people out here that are like that. Those are the people I stay away from. But now that we are doing this, the lockdown, or the self, like me, I'm not tripping. I'm not going to let it create such a fear of me that I can't see the light at the end of the tunnel. But I will respect the situation and try to do my part. Me being a transplant person, me having some mask on and gloves and having to be a certain way, that's not a stress. I'm no stranger to that.
Oh, you had to do that anyway. So when you were in the
I'm no stranger to that.
So how long were you in the hospital for? So we're finding out more information, like earlier signs of coronavirus. One of them is your eyes will be red. You have some red eyes, and then you lose like your sense of smell and taste. I really haven't had an appetite in a while. Yeah, it moves down. You may or may not have a fever either, but you definitely lose your sense of smell. And that's how you know, like early on, if you have it, you need to be quarantined. And then just watch for the rest of the symptoms because it kind of sneaks up on you. Kill the virus. The plaquenil is just opening the cellular door. So yeah, I'm doing it 3 times a day. And I'm eating. For some reason, pasta seems to calm down my stomach. I'm feeling so much better. Starting to see patients again on Amwell telemedicine. So Ooh, that medicine is a lifesaver. So, yeah, y'all. Ooh. Hi, I'm Veronica, nurse practitioner. How are you? You look terrible. You look so sick.
Yeah.
Well, thank you, Nakia, for coming.
Thank you for having me.
We're going to transition right into the corona virus that everybody's all scared about. Can you tell us a little bit about it?
Yes, I did a little research on the virus because it's new to us over here in the U.S. So the virus is carried by animals that can be transmitted to humans, and then humans can transmit it to each other. The originating.
Is it specific animals, or can it be like a cat or a dog? Because I'm like, how do
What they were saying is like birds and
Seafood
and bats?
and
Yes.
bats. Yeah.
So how?
We're going to
Okay.
get to that. Save
Okay.
your questions
Yeah.
for the end.
I will. I'm listening.
Okay.
So it originated in Wuhan, China, which was the origination point of SARS back then in
Yes.
2002.
Which is also known as the
Bird.
beta coronavirus. Not to be confused. Get it, girl.
And that virus had killed 800 people worldwide. So we know it's in, China, Macau, Thailand, Taiwan, Japan, South Korea, U.S. So 4 states in the U.S. have been confirmed, which is Washington State, Illinois, somebody in Chicago had it, Southern California, Arizona. Then Vietnam, Singapore, Malaysia, Nepal, France, Australia, and Canada. And so, like Nurse V said, the incubation period is 14 days. When you contract the virus, it's similar to like a cold. Sometimes people will have the virus and not know if they have a cold, which is caused by the rhinovirus or by the coronavirus. So it ranges from mild to lethally.
Wow.
So it just really depends on, we spoke about earlier, different people are susceptible to different diseases and viruses differently. Their bodies respond differently. So maybe the very young, the very old, and immunocompromised people. So if you have other,
Health
comorbidities,
issues, yes.
your immune system will be a little lower, which your body would react different if you contract it.
So, like she said, there was incubation period of 14 days. So you could have traveled to China 14 days 2 weeks ago, come back, and now you're starting to get the fever, the cough, you're short of breath, and that's about 8 days after you've contracted it. And then you have your imaging on your chest x-rays, you have infiltrate. And 20% of the people who contract it do develop critical illness, meaning on a respiration, like a respirator, you're in the ICU, it's life or death. And you can go into respiratory failure, organ failure, septic shock. And the most fatal cases are 73% of them are men. Men are, and they're at the median age is 49 years old. Yeah, with comorbidities. So they may have
Heart
diabetes,
disease, kidney disease,
anything,
diabetes,
anything else going on. So they're older. However, the young is always at risk. But yeah, what else?
So can I comment a little bit on that? The alpha and the beta are the only ones that can be transferred to humans. So with the MERS, which is the one that was found in Saudi Arabia, which is the cousin of SARS, and now you have this current new strain that's come up. So what's happening is it was initially just from animal to animal, like Nakia and Nurse V said, but now what happened in Wuhan is that it was at a seafood market.
Yes.
And they people were getting sick in the area, and they were finally doing the chest imaging and everything and found that they since contaminated decontaminated the area, but it's been because of the respiratory, it's affecting so many people. So that's what the concern is. And what we see, I see a lot of, I cover some different states. So one thing that a lot of, and I was just talking about this, a lot of universities are looking to increase their international student population. And with international travel, when you're looking at some of these states, and then how much, when you think about the air flight patterns that now people are going to Dubai, people are going everywhere, and the accessibility to get somewhere is
it's more affordable, it's quicker, and so you're going to see a lot of concern. So now the U.S. is actually testing people at the borders when they're coming in, but there's these cases that she's mentioned that are still coming through because
The
of the
incubation
14-day
period. Yeah, that's what I was
incubation
going to say.
period.
Like
Yeah.
if you're tested and you're in the incubation period, nothing is going to show, right?
Right. Unless you have
you're not.
sometimes people wait. Depending on where you are with your symptomology, it may present itself as a mild cold or a runny nose or something, a cough or something. The MARS had a GI component to it when it came about with Saudi Arabia. So they were having stomach problems, different things like that. So now it's such a, you've got these three now that are it's almost an epidemic is what they're saying now. When you're thinking about what's going on. And one thing that was, because third world countries don't always share their data or the science that they're getting from these outbreaks and viruses. So I was reading a lot of the US JAMA, a lot of the journal articles are saying now they're glad because they finally were able to look at the actual genome or the structure of the virus to try and figure out what's going on. But since then, it's spread.
So it's going to mutate.
And I did hear that China is underreporting their deaths related to the virus as well.
Which is unfortunate.
One of the medical professionals, I think she may have been a nurse, who got on but disguised herself, and she said there's dead bodies everywhere. So I don't know if that's true because I didn't get it from a reputable source, but.
But to piggyback off of that, and that's what the U.S. is saying, they need more transparency. What's actually affecting people in China, because you got it's showing up here, and you got people over here, or you got these increased study abroad programs and different things that they're working on it. They were working on a vaccine for this virus, but there's not one. It takes about 20 years to actually manufacture a vaccine. But now, because of what happened with SARS and MARS, they are trying to fast track that into a 5-year period. So just because of the epidemic that could occur worldwide, not even
shave 15 years off of making it.
Well, some of the stuff that happens is looking at other research that's been out there. So if you
the number is 313-778-7600. If you have any questions, I want you to call in. If not, you can put them on my social media. I'll read them off, and I can also ask our nurse practitioner. We also want you to be able to email us at thelealiveshow@gmail.com. You can watch us live on AM 910 The Superstation. If you are in your car, you're going to get in your car, I want you to tune in to AM 910 The Superstation. Listen to me all the way to wherever you go, and then tune me in on your phone, because I know you go nowhere without your phone. Once again, I want to also thank everybody for supporting. We want to continue to keep everybody in prayer. Right now, I want to go to the phone line. I have nurse practitioner Veronica on the line. Veronica, thank you for calling.
Hi, Leah. How are you?
I'm doing wonderful, and how are you?
I'm good.
You good? Good. I'm glad you're okay. I'm always concerned about my sister. Want to make sure that she's okay, because I know that you're actually working on that front line, and you're very open to be exposed, and then you also have young children. So first of all, let me just say thank you to you and the entire medical field for even stepping up and taking that time and taking that chance to go into the hospitals, to go into the medical centers, and to take care of those in need, whether they're family members, whether it's us, or whether it's just our everyday citizens. We just want to thank you. And I want to thank you because I know you're my good friend. So I just want to thank you because I know how hard you work. Look, I watch your social media. I know how hard you post, and you like to keep us informed. So I want to say I just really appreciate you on today. People not really sure.
Thanks for that.
People not really sure. So I want you to let them know, Veronica, you're on the front line. What is your right now compared to a couple of weeks ago? What is your everyday schedule? What is your everyday work atmosphere like today compared to a couple of weeks ago?
Well, things have changed a little bit at work. I'm actually self-quarantined now, so I don't really know what's going on at work. I haven't been at work since Wednesday, but I know they were setting me up to work from home. 2 days a week, I'll be seeing patients through the phone or the computer, FaceTime. And if you come in an outside clinic, they've closed the clinic where I work because we have clinics and then we have the hospital. So if you come in an outside clinic and you come in coughing, you immediately escorted out of the building with a mask, and we take you to the hospital and, let you get screened and possibly tested.
So let me ask you, if someone is at work right now and they're feeling sick, is it the first symptom that you feel sick? Is it the fever? Is it because I've been hearing fever, I've been hearing headache, I've been hearing people saying they have and then I'm hearing a sore throat. So what is it? You really don't know who's sick. So at your job right now, what caused you to feel like you were sick and then for them to send you home? Like, what were some of your symptoms?
Well, here's the thing, there's several different strands. We're not even sure how many strands there are right now, but the ones that I have seen over and over again, I've narrowed it down to a few that I've seen multiple times. So basically, you have a head to neck complaint, so sore throat, ear infection, sinus issues. No, it's a dry cough. There's no real runny nose or anything like that, like allergies. But they'll say they have like some scratchy throat or sore. Then you have those that have like trouble breathing. They literally cannot walk from their room to the bathroom without like literally laying on the ground because they're so out of breath. They can't talk. They may be wheezing. And then you have those that are from the diaphragm down. So you have these sharp belly complaints, usually on the right upper quadrant by your liver. And it's like, usually starts in the back near your kidneys, and it's a poking, sharp, like somebody's poking you in the back through your liver. And also when they're breathing, you breathe in like you're kind of like on a really, really cold, dry day. When you take a deep breath, you have sharp pains in your lungs. So there's 3 types that there can be. I don't know if it's moving from the throat on down. I know that by the time you have the GI complaints, most people have had some type of upper respiratory infection with a dry cough. They might not think anything about it because they don't feel sick. They may or may not have a fever with any of those complaints. Fever does not necessarily mean that you have an infection going on. So they really, are not going to admit you to the hospital because you have a fever and a cough. That's just saying that you do have an infection going on, but that's not, life or death. You know what I mean? It's all about your past medical history. You have a cardiac issue. You've had a transplant, whether it's a heart transplant, kidney transplant. You've had a history of cancer. You have COPD. If you're a smoker, these are any kind of cancers. I think I said cancer, but those things put you more at risk, and you're more liable to be admitted to the hospital.
So you're at risk more so if you have issues with your lungs, with your heart, if your lungs are exposed, correct? If they're weak. If they're weak.
If you have like a lowered immune system. Like if you had a history of cancer, you could be on immune, like something like HIV, something like lupus. You have a really like a heart transplant. You had heart issues in the past, COPD, you're a smoker. Right. You have underlying medical conditions prior to getting this infection.
So let me ask you this. So people who have previous health issues are more prone to getting the coronavirus and it being more terminal with them, correct?
I wouldn't say they're more prone of getting it. I would just say if they were to contract it, it could be detrimental if they don't seek medical attention.
Wow. Okay. Now let me ask you this: so I saw like the DJ who had passed away this past weekend, and they said before then he said he felt like he had the flu. Now, my question: when they're saying individuals are dying from the coronavirus, is this due to they catch the virus and then it lingers over, or they end up catching pneumonia, and then that's what causes the death, or is it the actual virus?
Well, what happens with the sequel of the coronavirus is that most people, if they do catch it and it does end up infecting their lungs, eventually they do go into a viral pneumonia. And because it's not bacteria, with bacterial pneumonia, like walking pneumonia, we're really used to that, and we can give you an antibiotic.
Okay.
With viral pneumonia, we can't give you an antibiotic because it's not bacterial. And what happens is the lungs fill up with fluid. You have this ground glass look to the which is where the infection is, and it kind of attacks the organ. So your body goes into, your immune system goes into overdrive trying to get at the infection, and it's detrimental. And most people who are really, already have underlying issues with breathing, they end up getting intubated and in the ICU.
Now let me ask you this: what are some things that people right now can take at home that's natural, that they can help, that would help prevent them from catching it or even building up their immune system right now?
Oh, they can take so many things. Zinc is the biggest one.
I saw that zinc. They said taking zinc right now is, and that's something I already had in my house. So right now, zinc will help build your immune system as well.
Yes, it's an immune support. It'll support your immune system so that your immune system can fight off any viruses, even a common cold. It'll help you get over it a little bit faster. There's studies that have actually been published about that. Zinc is one of them. Vitamin D is huge. A lot of people are low in vitamin D. When you're low in vitamin D, which is a sunshine vitamin, Michigan doesn't get enough sunshine. So we're more susceptible to viruses. Also, people like vitamin C. Vitamin C has an antihistamine effect. So just like you take a Zyrtec or a Claritin, vitamin C will help the inflammation. So those are three really good ones that you can take.
Okay. So right now, to those who are just tuning in, you said we have nurse practitioner Veronica on the line. She told us right now, for those of you who are wanting to know just some everyday over-the-counter health supplements that you can take right now. You can take zinc, which you said support the immune system. Vitamin D, which is a sunshine vitamin, which of course we know living here in Michigan, that's not often unless it's in the summertime. Vitamin C, which controls the inflammation, correct?
Yes. Antihistamine release. Yep, like a Zyrtec.
Right. Now, are there any foods? Are there any vegetables? Are anything like that that people can take, or every day? Since everyone is off right now, everyone's diet is just we don't want to just fill up on hamburger and all type of things. Is there anything right now that we can have this even dietary that we can we can cook or that we can eat? I don't know if people always say kale or ginger. Is there things right now while we're off that we can even even as our children that we may want to add to our everyday menu?
There's not a whole lot of dietary things you can do. Just if you do develop a cough, I would just say the biggest thing as far as medicine wise, I would stay away from Motrin right now. But you can add garlic to your foods. That has a lot of antioxidants.
Now let me ask you, I hate to cut you off. You said stay away from Motrin right now. Now why is that?
There's some studies that are going on, and this is so new. It's called the novel coronavirus because it's new. It's foreign to us. And Motrin, they're looking at Motrin to see if it makes the virus worse or better, and they're finding that Motrin does interact with the virus. So if you do have a fever, you can take Tylenol. Don't take Motrin at this time. And those that are wheezy or have trouble breathing or have even an issue with their heart, Motrin, Aleve, naproxen, all of those, you really should stay away from those anyway.
Okay. Thank you. Ron, I want you to stay on the line. I have some callers, and I want to see. I want to see if they want to have any
Because
questions for
I
you. So please
really
stay by the phone right
have
quick.
been giving my patients, I'm a nurse practitioner by profession, you know, the Real Nurse of Detroit. People who know my podcast, they know me. But I want you to tell us a little bit about yourself and how you came up with this product.
Yeah, great. Well, thank you, Veronica. I really appreciate you reaching out and your interest in what we're doing with Easy CPAC. Just a little bit of background about me. I'm a general surgeon by background, and prior to my clinical years, I used to work in healthcare policy in DC at the National Institute for Healthcare Management. And a lot of my work involved collaborations with private insurance, primarily Blue Cross Blue Shield, as well as the Centers for Medicaid Services, CMS, as well as the CDC. And so a lot of my work at that time revolved around how flaws in the design and delivery of healthcare system contribute to patient disease and problems of this sort. And so in my clinical practice, I deal with complex infections, and a lot of these complex infections have been a result of flaws in the way that we deliver healthcare. And so when patients come in, reduce the fever. However, when you think about it a little bit more on a kind of a macro level, when someone has a fever, that is a normal immune response, typically. So when we get an infection, our body raises the temperature to a level that that virus or bacteria can't live. So some degree of fever is actually beneficial to the patient. Where it gets difficult is if the patient is uncomfortable, the patient starts losing fluids, becomes dehydrated, or if the fever gets to be too high, which can cause other sort of complications, seizures, and so forth. So I think that overall it is helpful to have some understanding that as a patient that if I have some fever, they need some sort of reassurance that it's not the end of the world to have some level of fever, and that that fever to some degree is helping you clear the infection. That's a normal immune response. Obviously, if you're feeling uncomfortable, you should definitely take cold fluids, and Tylenol or some acetaminophen or some sort of fever reducer is reasonable to take as well. You don't want your fever to get too high because you can have other more serious complications.
Okay, well, I know you have to run, but one quick question.
What I do is I'll talk a little bit about the product. So
okay.
The story is Easy CPAC. When I was pouring through the data, obviously we don't have very good products that treat viruses. And largely the reason that we do not have good products to treat viruses is that viruses mutate at such a rate that it's very difficult to create effective antiviral products. While there are some that exist and some that are continuing to be built, for upper respiratory infections, we have not kind of come to the stage where we have amazing or fantastic antivirals. And this is where precisely the role of immune support comes in. And it's something that I think that people listening should think about before you're running for that antibiotic or other medication. Think, if I have a virus, there may not be a specific cure or treatment for that virus. And a more appropriate approach may be to support my immune system's ability to clear that infection. And so that was the concept behind Easy CPAC. So in times when you are not having the healthiest diet or lifestyle due to travel, long or irregular work schedules, stressful life situations, perhaps you've been in close contact with others who are sick, maybe you have chronic disease like diabetes and so forth, maybe you smoke or you drink alcohol, types of situations where your immune system can be weakened. And in these instances, there is a role, in my opinion, for for a supplementation of your immune system. And so when I went and looked at the products that existed on the market, they were some very nice products in terms of the concepts, but they weren't so much based on what the clinical data shows. And I wanted to bring a product to my provider colleagues as well as to patients that was based on what the data shows. And so if you look at the data, zinc actually has the highest level of clinical data supporting its use. If you look at the data even more broadly, zinc acetate has been shown to be the most bioavailable form of zinc and is in fact the most well-studied form. There are some other preparations that I think also have some reasonable data behind them, but zinc acetate is a very good form of zinc. And when you look at those supportive studies, lower doses, and this is very common when you're looking at dietary supplement research, is that you'll find that lower doses can often be supported in prevention and higher doses can be supported in treatment. So they're commonly the same products can be used for both prevention and treatment, but at different doses. And so that's a very important point when you're considering the use of a supplement in times that I've described before. So in this case, the dosing of zinc is very high in Easy CPAC. And you'll find that typically if you're trying to prevent a viral illness with zinc, lower doses are reasonable, roughly 50 milligrams of zinc. If you want to treat a cold or a viral upper respiratory infection like colds with zinc, then 80 milligrams is where a lot of the data sits. And so interestingly, vitamin C does not have a tremendous amount of data supporting its use. It's relatively limited, but vitamin C is extremely popular. Typically the normal body only absorbs 400 milligrams of vitamin C. However, you find people will take 1,000 milligrams of vitamin C or more. And what people benefit from larger doses of vitamin C is primarily the antihistamine effect of vitamin C. So basically, you take a large dose of vitamin C, it has an antihistamine effect, you feel less congested for a period of time. So I take some vitamin C on my stuffy nose, oh, my nose is less stuffy. So people do find some benefit to it, but the benefit in terms of reducing the duration of the illness is relatively limited. And in terms of prevention, vitamin D actually has a stronger level of data supporting its use than vitamin C for the prevention of viral illness. And the common cause of viral illness, common factor in viral illness in the cold and flu season is vitamin D deficiency. We have less sunlight in a lot of parts of the world during the winter months, and can be a common risk factor for developing an upper respiratory infection. So that's basically the story. The data on echinacea is quite nuanced. I can speak to it for quite a while, but know that the echinacea that we use is much higher dose than you would find in an average product. And we use a very high quality whole herb certified organic form of echinacea, which reduces some of the issues I've observed in some of the other products when I was looking for a solution for patients and trying to support my colleagues.
Well, that's awesome. Thank you so much for coming and explaining that. You just broke everything down. I have no questions whatsoever. I think my biggest question was the dosing and the zinc. I'm a firm believer. That's why I was really happy to see one of my medical colleagues, creating a solution. So thank you again. I know you have to get back to work with all the coronavirus going on. So hopefully we can do this again.
Absolutely, Veronica. I really enjoyed meeting you, and yeah, let's get together again in the future.
All right. Thank you.
Bye.
Bye. All right. So Next we have Miss Carmel. Correct me if I'm wrong. Carmel Larson. I might have messed that up. And
No, Carmel Larson.
Carmel. Okay. I need you to tell me about your service. I'm like, I wish I would have thought about this. And especially right now when we're quarantined, or and some of us that are in the medical field, we still have to go to work. If we're not sick, we have to go to work. And if the daycare is closed, if the school is closed, what is your solution and what option are you bringing up? Because they need to hear this, because I was happy to find you.
Well, I'm glad you found us, and thank you so much for sharing. We just had our 3-year anniversary, and it really feels like this childcare solution was possibly made for just this moment. What we created is a technology that links together mothers or parents. It's anyone 18 and older. It just so happens that 99.9% of our platform are mothers or women who have created a profile to become a Momni host. It's like childcare in your home, and you can host other mothers' children. It's kind of like using the Airbnb and Uber app, but instead of getting ride sharing or room sharing, we call it care sharing. So you can download the Momni app, and then you go and put in your zip code or city, and it pulls up a list of all of the available Momni hosts in your area. It's a free market system, so everyone sets their own price. We have eliminated all fees, and through the end of April, that might even go longer, who knows what we're up against here with these crazy times. And so you can find another mother within minutes, really, sometimes a little bit longer, shorter, and drop your child or children off, or what's like a paid play date. A lot of people are really appreciating it right now because with the concern of spreading the coronavirus, a lot of people like yourself potentially, or people you work with, you still have to have childcare with schools closed, and you've got to go to work and help others. But the ratios with a Momni home, with a Momni host, are much better. You're typically seeing 1 or 2 children being dropped off to a family rather than a daycare overwhelmed with high numbers. And so it's a really great option. Or for many people who might be restaurant workers who are out of a job temporarily, they could sign up to be a Momni host and have a side hustle from home. It's kind of like being an Uber driver, only you can watch kids from home, set your own schedule. It's completely family friendly, flexible, set your own price. So it's really solving 2 problems simultaneously.
Right.
Bringing
so how do we know the background? I'm sorry to cut you off. Do you do background checks prior to? So say for instance, I get on there and I want to host. I have a 2 and a 9-year-old, or a 4 and a 9-year-old, and I'm looking to host anybody between those ages, and I'll do it on my days off, so the weekend, so the kids have somebody else to play with. Do you do background checks prior to you getting on the site? How does that work? How do we know I'm dropping my kid off somewhere safe with somebody safe?
We do have background checks. It's an optional add-on that you can filter for. And if you do have that background check verification, it means not only is the host background checked, but all adults 18 and over in the home have to be background checked for you to see that person, that home, has been background checked. We made it optional because when we first launched, it was required for every single host. But we switched to making it optional because a lot of people are joining the platform as PTA groups, church groups, neighborhoods, book clubs, and when you know the people who you're doing care sharing with, that need to have a background check is less in the forefront of your mind. But if you are taking a referral for someone or going off ratings and reviews, then many people do want the background check. And also if you're a host and you want to increase your chances of being booked, then you would want to add that background check. We also have other security measures in place.
Okay, so I know I'm a single mother. I'm divorced, and I tried to go on care.com. How does this make you any different than care.com? Because care.com is a little shisty. I'm not trying to throw, shade on nobody. I'm just saying this is my experience. I did sign up on your site. I haven't used it yet, but I never ended up booking anybody on care.com because when I did like a Zoom like this, I had my girlfriends and one of my other friends. It'll be 3 of us interviewing somebody like this, before I let them in my house, I wanted to get a feel for them. So I can't just drop my kids off with anybody. I'm mommy bear, and we did the background. People can pass background checks and all that and still not be somebody I'm comfortable leaving my kids with. So how do we, how's
Well,
the care.com? Let me go there.
There's three main differences with Momni. One is a financial one. With care.com, you have to pay a monthly subscription fee, and Momni is free to use for everyone. It's just an open marketplace. You only pay when you book with someone. You pay their rate to them, and right now all of our fees are waived, which if they come back in the future, it's more like Airbnb or Uber, where we keep a small percentage from each side. And the second main difference is most of our providers are mothers, whereas with care.com, there are some mothers, but you're mostly interacting with young adults who are college students or nannies, or on some babysitting platforms, you're getting teenagers. So the Momni community is really linking mothers to mothers. We are really trying to help solve the global childcare crisis as a community of moms. And the third main difference is we have a strong verification process that you have to go through to be either a guest or a host. And so there's no trolling on this site. You know exactly who you're communicating with. There was actually some articles that came out about 9 months ago or so where care.com had some security issues because people were not who they seemed to be. And they've now fixed those, thankfully, but the measures we have in place with our 5-step verification system to sign up, those security breaches would never have happened on the Momni site. So we have a gesture selfie that we require everyone to provide, that we vet against a government ID that matches the profile picture, and we also verify email and phone number. And we don't share personal information of phone number or address until both sides have agreed that they want to create a reservation together. But we also encourage people. What we're finding is most people, once they've agreed to, they've been referred to each other or they want to engage, most of them have a meetup first, like you would go and, meet a daycare, meet a new nanny. Most people are engaging as adults first, not just dropping their children off at first glance. And so it's a really safe platform, and there's a lot of friendships developing as well, not just the children, but the mothers, and then they tend to continue to help each other.
That's awesome. I thought it was a great idea. I just have to sit down and find time to find a mom friend so we can exchange babysitting. I think it's great. I think it's a great idea. So I wanted to give some options. How does anybody find you? What's the name of the app? How do you spell it?
Well, it comes from the Latin root of omni, which means all and everywhere, like omniscient, omnivore, omnipresent. And M to that, you get Momni, M-O-M-N-I. We're linking all moms everywhere to help solve this childcare crisis. You can find us in the App Store, Momni app. We've got Android and iOS, or momni.com. And there's also the Momni Foundation, momnifoundation.org. You can learn a lot about how for every hour of care provided by a Momni host, we are giving an hour of care to a mother in need. So right now we're placing a huge amount of childcare grants into homeless shelters, refugee centers, single mom organizations. We're planning to take this program global as soon as possible. Right now we're placing those domestically because the need is great here, right now.
Yes. Thank